You are listening to socialtv.co.za with myself, Nokuthula. In our top stories, African Development Bank to commit $10 billion to end hunger on the continent. And Standard Chartered announces €149 million social loan financing to build a new hospital in Angola. Starting off with our top story, the African Development Bank Group will commit $10 billion over the next 5 years to boost Africa's efforts to end hunger and become a primary food provider for itself and the rest of the world. This was announced by the bank group president Akinwumi Adesina at the Dakar 2 Africa Food Summit at Diamniadio, east of the Senegalese capital of Dakar. Adesina called on more than 34 head of state, 70 government ministers, the private sector, farmers, development partners, and corporate executives to work out compacts that would deliver food and agriculture transformation at scale across Africa. He encouraged them to take collective action to unlock the continent's agricultural potential to become a global breadbasket. The Dakar 2 Summit, under the theme Feed Africa, Food, Sovereignty and Resilience, took place amid supply chain disruptions caused by the COVID-19 pandemic, climate change, Russia's invasion of Ukraine. More than 1,000 delegates and dignitaries attended, including the President of Ireland, Michael Higgins. Moving on to our next story. Standard Chartered announces €149 million of social loan financing for the Angolan Ministry of Finance to build a new hospital in Quilamba with a specialist burns ward. This is the government of Angola's first social loan. The financing is backed by Export Credit Agency (ECA), UK Export Finance (UKEF), and ASGC UK Limited, in the contractor responsible for managing the construction work. Standard Chartered acted as sole bookrunner, original lender, facility agent, structuring bank, and mandated lead arranger. The project is being developed by the Angolan Ministry of Health and involves the design, building, and equipping of the hospital. It is part of the government's National Development Plan for Angola 2018-2022. Quilamba is a large residential area just outside of Angola's capital of Luanda, and the new hospital will help provide better healthcare services for the city and surrounding areas. The hospital will have 7 floors and capacity of 250 beds. Not only will it boast a dedicated unit for the treatment of burns, but will offer general healthcare services. These include accident and emergency, palliative care, general and pediatric clinic, surgery, geriatric care, pathology services, transfusion services, a physiotherapy service, and infection control and prevention. Standard Chartered structured the financing to fully comply with the social loan principles, SLPs, and the project also contributes towards meeting the United Nations Sustainable Development Goals, which relates to ensuring healthy lives and promoting well-being at all ages. Additionally, it aligns to environmental and social risk management, international best practices. Mama Money, a rapidly growing fintech that offers cross-border money transfer and banking services, has partnered with AFC Commercial Bank, a market leader in Zimbabwe, with a reliable and robust payouts network. This partnership allows Mama Money customers to easily send money to any AFC Commercial Bank branch for cash collection at 45 locations across Zimbabwe. It's estimated that the monthly remittance flows from South Africa to Zimbabwe range between $30 to $60 million through both formal and informal channels, and accounts for over 10% of the country's GDP, according to the World Bank. But the cost of sending money to Zimbabwe can significantly reduce the impact that remittances have, as these funds are predominantly used for critical needs such as school fees, healthcare, and housing. In 2015, the average cost of sending money from South Africa was 14%. This is the same year that Mama Money launched with a fee of just 5%. Today, the average cost of sending money from South Africa is 7%, which is much closer to the worldwide average of 6%. Together, Mama Money and AFC Commercial Bank are improving access to critical financial services in underserved communities in both South Africa and Zimbabwe by making it easier, faster, and more affordable to send and receive money. In our final story, for vulnerable children and youth, having a supportive mentor can be a lifelong changing experience. Numerous studies over many decades have shown that having a healthy relationship with an adult mentor can put a child on the path to better behavior and stronger relationships, committed school attendance, and improve academic results. These are impacts that last a lifetime, as mentor relationships are also highly effective in fostering interpersonal skills, a growth mindset, and self-mastery. 55 South African men across the country are currently serving as vital mentors for 250 boys who are growing up without their fathers. This band of everyday heroes are volunteers for the charity company TCC, a non-profit organization that has been implementing a mentorship program for the past 9 years. Founder and director of TCC, Jaco van Schalkwyk, says, "Our goal is to turn the tide against the violence in South African culture by helping to raise boys to be good men through our activity-based program. Our strength is our incredible team of mentors who make a solid commitment to the boys they mentor and embody the values and good character we aim to inspire in them." It is estimated that 70% of South African children are growing up in single-parent homes, and 4 out of 5 boys do not have a consistent positive male role model in their lives. Broken masculinity is associated with the country's high rates of gender-based violence, crime, gangsterism, substance abuse, and other mental disorders. To recap our top stories, Standard Chartered announces €149 million social loan financing to Bulletin Hospital in Angola. For more CSI news, you can visit our website at www.socialtv.co.za.